My name is Rose Venegas, Roseveniegas. And I am honored to be here with you all today. I'm a senior program officer with the California Community Foundation and grateful for the chance to say hello to so many community members, partners, and leaders who are leading the efforts in LA County. Please take a moment right now to introduce yourself, include your name and your organization into the chat. And that way we can say hello to everyone on the call today. We've been fortunate that over 175 community members, leaders, community health workers, funders, as well as friends and colleagues have joined us on this convening. And on behalf of the California Community Foundation, welcome to the overview of Southern California initiatives. As part of our agenda today, we'll hear a brief introduction about each of the initiatives that have been funded so far. We'll also preview some of the work that is on the horizon with regard to funding and implementation opportunities for community health worker outreach initiatives. And we'll also have a presentation from some community partners that will be disseminating communications here in Los Angeles County and in the greater Southern California area. If you're just joining right now, welcome to the LA and Southern California Outreach and Systems Navigation Initiatives. Please, if you are able to, drop your name and the name of your organization into the chat just so we can say hello. Please also mute yourselves. We have over 100 participants right now, and so we'll ask to just maintain a lower level of audio background by being on mute. If you have any questions or comments, please feel free to use the chat box. And we will be recording the large group sessions, but not the small group sessions today. So as part of our agenda, we will have breakouts planned, and so you will be assigned to a breakout group. While you're in that breakout group, there is no recording. However, we will have a note taker in order to capture the responses that are shared in that group. And also, if you require sign language interpretation, please let one of the hosts know via chat so that you can be placed into a small group breakout. If you can let Aurora Anais know, then she'll be able to add you to the appropriate breakout where there will be access to sign language interpretation. We want to acknowledge the support of the LA County Department of Public Health to provide assistance with the sign language interpretation as well as the CART translation during our meeting today. And if you have any other assistance needs, please let us know and direct message one of the hosts. So if we could go to the next slide, please. Thank you. And just a brief overview of our agenda. Please introduce yourself in chat with your name and your organization. And I want to also acknowledge our wonderful partners who help make this convening possible by joining us for a partnership planning meeting. We have Kate Anderson and her team from the Center for Strategic Partnerships. We have representatives from the Health Services Department at LA County, the Department of Mental Health, and the Department of Public Health. We also have representatives here from the California Community Foundation and my colleague, Deanna Colleen, who is leading the California Department of Social Services initiative. Following the overview of the initiatives, we'll break out into some small groups for about 30 minutes, and then we'll come back into the large group meeting to share back some of the ideas that were shared. And then at the end of the day today, we'll have a brief presentation by our partners at Kaiser Family Foundation regarding a new communications initiative that they'll be launching. And now we are now at 133 participants in the room, and I'm very excited to learn more about you all. So Aurora, if you could launch the first poll to see who's in the room with us today. So if you could select the roles that you play with the organization that you're with regard to outreach, education, and systems navigation. And you can select more than one option because we know that many of us are filling multiple roles these days. Give it a couple more seconds while folks are filling in the first poll for today. Great. I think if we can go ahead and close the poll, I think we're almost there, Aurora. And it's wonderful to see so many folks. We're now at 140 participants today. And the roles that we play at our organizations include directly conducting outreach, education, and systems navigation, supervising teams, including individuals and leaders who are conducting these activities. We have a group of funders here on the call, and folks, take a look at the tile next to you. There may be a funder sitting next to you on the call. So, want to make sure that we include our fellow colleagues who are able to support these initiatives. And we also have a few members in the room who have other roles with their organizations. And for those of you who selected other, if you'd like to just type that into chat and indicate what role, unique role you play within your organization with regard to outreach, education, and systems navigation. And while you're doing that, if I could ask for the next poll. As part of many of these initiatives, I know that we took advantage of some of the training and professional development opportunities that were available through the various initiatives. And so we'd like to ask you very quickly to indicate which training you received was most helpful in your current role with the organization. All righty, I think we can go ahead, and if everyone's had a chance to fill out the training question, then we go ahead and close the polling. Excellent, thank you. Well, it looks like, not surprisingly, given that many of the initiatives were funded through COVID relief and CARES Act work, that COVID information was the most useful. And this information will continue to be useful and evolve as we know that additional education and data are being reviewed with regard to the vaccines and vaccination availability. But it looks like also one of the trainings that was spotlighted here by the comments are trainings on trauma, resiliency, and well-being. And given the level of direct individual and personal contact that the community health workers, outreach individuals, and navigators were having, we know that that particular training will continue to be very important and very useful. And so I appreciate everyone sharing, what type of training was most useful for them during their roles. And we'll look forward to other resources in the future related to these topics. So why don't we return to our slide deck. Thank you very much, Brittany and Brian, for moving us through the presentation. So I wanted to provide a brief overview amongst some of the various initiatives that have been launched here in Los Angeles and the greater Southern California area. The initiatives that you'll hear about span 3 counties. The majority of the initiatives have occurred and are occurring in LA County, but at least one of the efforts that's listed here, the California COVID Community Health Project, also funds efforts in Orange County and Ventura County. And we'll also have a brief introduction to some of the future initiatives that we're anticipating through which there may be funding opportunities. So we can go to the next slide, please. One of the things that we've done in order to visualize where these efforts are happening is to create a map of locations where many community health worker outreach and navigation organizations are operating. And I'm going to briefly share my screen here. I'm going to switch over to the map where some of this outreach and navigation is happening. And just to let you know, there were over 188 sites shared with us in order to develop this map spanning 3 counties and over 100 organizations that are visualized here. And many of you know that the priority communities identified, particularly for LA County, drew from community wisdom regarding which communities would need to be addressed with enhanced COVID education, as well as other systems navigation and outreach information. Of note, we know that people also are concerned about where outreach is occurring with regard to COVID case density, and these data were current as of the end of March. So in this map, what you see are areas where the COVID case density is higher, as depicted in the darker purple shading. It's also areas where there are higher concentrations and numbers of organizations operating with regard to these outreach and system navigation initiatives. We'll also be sharing information and these links with regard to where outreach needs to occur as we move into the scale up and mass implementation of vaccination efforts. In this map, what you see in the darker shaded areas are areas where there are relatively lower percentages of people being vaccinated. And so community health worker outreach and systems navigation initiatives will continue to be important in these particular areas. And we welcome your feedback and input during the small group sessions to understand how community messages can better be integrated into the communities that are depicted here. So I'm going to stop my share now and return to the regular presentation. So if I could ask one of our hosts to bump me out of the share and then move us back into the regular presentations. And so why don't we start with a brief overview of some of the initiatives that are operating here in LA County. First, we wanted to express our gratitude to Kate Anderson and the team at the Center for Strategic Partnerships. Through her partnership with the Departments of Public Health and Health Services, they've been able to augment efforts through the COVID-19 Equity Fund to fund community-based organizations, workers' councils, and clinics in highly impacted areas. Thank you very much to Worker Education Resource Center for providing many of the trainings to bring in additional skills as well as core information with regard to these initiatives. These efforts were made possible through a pooled grant from the Together Towards Health, which is operated by the Public Health Institute. And PHI is an organization that's brought together over 12 foundations supporting the COVID-19 equity work. If you would like to learn more about the Together Towards Health and PHI initiative, please feel free to click through to the URL that's listed there. We'll also be following up and sending out these slides and the links in a meeting follow-up after this meeting. So don't worry if you're not able to click through today. We'll go ahead and make that information available to you. The next partner that is launching or creating and providing resources to community health worker initiatives as well as outreach and systems navigation is the LA County Department of Health Services. Many of you on this call are likely participating with DPH and community partners, the entity, to serve regions and communities disproportionately impacted by COVID. Many of the grassroots organizations that you represent and lead are providing culturally and linguistically appropriate services, leaning into community trust to engage with members of our communities who have reason to resist or be concerned about health services in their area. And also reaching out to historically under-resourced communities throughout LA County. The funding, mentorship, training, and technical assistance that's provided under the Department of Health Services and DPH partnership helps to build the workforce and sustainability of these efforts. If you'd like to learn more about the efforts of this partnership, please click through to the covidhelpla.org website, and you'll be able to see some of the services that they're providing. Go to the Department of Public Health. The next initiative, and this is an initiative that CCF has been partnering with DPH on, was launched as part of the CARES relief effort last year and has been extended through the end of this year in terms of the ability to spend out. This partnership includes 16 organizations and 3 trainer entities that mobilize additional grassroots peer outreach networks. It's also built on a platform of workforce development, as well as some of the trauma and resiliency oriented trainings that many of you highlighted was an important support in the efforts that you led. From October 2020 through March 2021, more than 340,000 outreach activities were completed both virtually and in person, reaching approximately 870,000 people countywide. And we know now more than ever, receiving these messages from trusted community members is what will make the difference as we scale up into the mass vaccination efforts. In addition to building up capacity within our communities, this also supported capacity building within the Department of Public Health. To learn more about these efforts, please feel free to click through to the link indicating the extension of the LA County Community Health Worker Outreach Initiative. And our next initiative is being led by the LA County Department of Mental Health, and several of you on the call are likely members of the Community Ambassador Network. This network includes over 200 individuals, including an additional 50 who are trained in a community resiliency model. The collaborations include organizations funded under the Mental Health Service Act, the Department of Public and Social Services, CalWorks, as well as training partners at UCLA and the Community Resiliency Model developer. As with some of the previous initiatives, this effort is resulting in over 100,000 community members being reached through community events and social media, and over 3,000 referrals being made for resources and support. So navigation happening in almost real time. The over 200 community ambassadors that have been hired have made over 14,000 referrals and over 13,000 successful linkages. And we know this is another model that we hope will be sustained over time here in the county. And we have certainly as part of a statewide partnership effort, CCF is also supporting in partnership with Sierra Health Project and the Center at Sierra Health Foundation, the California COVID Community Health Project. I have to say, the names of these initiatives are quite a mouthful. Try and say that 5 times fast. There are 50 organizations funded, and this spans 3 counties, and 5.7 million, I think, is just the initial investment in these efforts. This also includes outreach, education, and dissemination of COVID-19 information, and also building skills to mitigate the risk of COVID-19. We know that some of the efforts being planned as part of this initiative will bridge to the vaccine scale-up efforts and also integrate efforts around harm reduction practices and behaviors. And so thank you very much for your engagement, your leadership, and your ongoing implementation of these initiatives. And it's great that folks are seeing themselves in some of the photos that we included that were shared by our partners. And if you'd like to learn more about these initiatives, we will follow up with information and links about where you can download the information about the organizations that have been funded, as well as any new opportunities that may be on the horizon. So thank you very much. And I just want to say, congratulations to all of the organizations that have launched what is the largest public health endeavor that any one of us will take in our lifetimes. This is such an important effort right now, and we will look back on this day and know that each of us made a contribution to advancing health in our communities. So give yourselves a round of applause and cheer on the person in the tile next to you. Please continue to advance these efforts in our communities. So I want to move to, I think we have another, perfect. These are certainly times that are challenging for all of us. And as a community health worker, person who's doing system navigation, or even someone that's talking with a small business owner about the challenges that lay ahead, you may be experiencing, concerns, anxieties, and other stressors. And so the state of California has made available for all of us access to assistance with the stressors that we're all facing right now. Certainly we know, and having seen the comments and the responses to what training was most helpful, trauma and resiliency training, and the ability to find ways to cope and find social support for this. So if you know someone, or if you yourself and your colleagues are experiencing some of these needs, then please connect to CalHope to be able to access those services. And we temporarily lost our slides for a moment. Hopefully they'll come back again. Alrighty, and thank you very much, Brian, for bringing back the slides. We are going to drop now into our small group discussions. And so please hold on for a moment while we assign you to the small group discussion groups. Once you're in your discussion groups, the questions will be dropped into the chat by the facilitator. So this is just a preview of the small group discussions. And just to share with you the way that this will roll out is we'll have our facilitators ask each of you to introduce yourselves, name and organization again very quickly. And there'll be a quick share. And then we'll go into the small group conversations. And we'll ask several organizations or several small groups when you return to the large room to share out what you discussed in your small groups. Small groups are not being recorded. We will be taking notes, and those will be shared back out with the team that's facilitating the session today. So hold on. You will soon be assigned to one of your small groups. And please take the time to introduce yourselves to your colleagues in that small group setting. And Aurora, thank you very much for moving us into the rooms.
So everyone should now, in just a few seconds, be sent to different breakout rooms.
Yes. Okay.
Oh, if you do need assistance with sign language interpretation, I believe that group 1, Aurora, is that correct? Group 1 is being designated for that assistance. And if you need assistance with sign language interpretation, please, please let Aurora know so that she can immediately match you to the appropriate room. And thank you very much, Dawn. We appreciate your wonderful signing for us today. And we're going to keep the spotlight on you, Dawn.
Thank you. Yeah, I'll be staying.
Yeah, we're just waiting to be assigned to the small groups now. So thank you, everyone, for your patience. Thank you very much for your patience and grace. I know so much of what we do today relies on grace and patience. We're having a few technical difficulties on our side. I want to express gratitude to Dawn, who's helping us with the sign language interpretation today, to Leandra, who's also helping with the cart. And if you need assistance with sign language or cart, please message Aurora, one of our hosts, and she'll be able to connect you so that you'll be able to access that information. My name is Rose Venegas, and welcome to the additional people who joined us today. We are now returning from the small group discussions, and hopefully each of you had a chance to meet a new colleague, a new friend, a new comadre in terms of this work. We're really pleased to be able to have you in the room. And thank you also to our facilitators. I want to express gratitude to community health councils and the DPH liaisons who served as the facilitators in your groups. I'm going to ask a few of the small groups to share out one set of comments from the questions that you all discussed. And I'm going to start with group number 1 and ask if the facilitator from group number 1 or any participants from group 1 would like to share what supports were helpful as you conducted this program and initiative of outreach, systems navigation, and education. And so if I could have the facilitator from group 1 introduce themselves and then share just a few responses for the supports that were most helpful.
That was the group with Dawn.
Yes. Is there a facilitator from group 1? And if not, then if you were in the group with Dawn and would like to share some examples, you can share it in chat, or you can also.
Rose, this is Wendy Tovey from DMH. I can share a little bit. We talked some about adjusting from in-person to doing a lot of things online. So one thing that Heidi shared that I don't know how much it's being done is looking at text message blasts, which I think are incredibly helpful. We talked about a lot of, social network platforms and doing a lot of outreach and information through there. And so all platforms, Facebook, Instagram, delivery in that way, and then doing a lot of meetings and outreach and connection via Zoom and Teams, along with outreach and engagement activities such as food and clothing and diapers. And one thing I know that the Innovation 2 providers have been doing, along with when they are distributing food, they'll also add in information about COVID for education, and they'll do some wellness and well-being activities included as well about the trauma of COVID and how to have conversations with your families and your kids and come together. We've also had the opportunity to enclose like Twister or Candyland, so that's increasing the family time together, or just cards. And we get a lot of pictures back from the families doing these activities. So it's nice to be providing them with food, but then we're also helping them hopefully to come together and deal with some of the trauma that they faced through this pandemic. And so those are some of the things that we talked about that we're doing.
Well, thank you to that group. And Wendy, thank you very much for sharing examples from the group. So it sounds like social supports and even building some social connection is part of what helped in the implementation of this effort. So thank you for sharing that example. I think that's a terrific example. Wanted to see if we could get the group that was facilitated by Tomas Duran. Tomas, are you able to come off of mute? And
yeah.
share? Okay, excellent. So we'll ask you a question of what is an innovation that will be continued? So what was an example of an innovation that will be continued? And thank you very much, Tomas, for facilitating your group.
No, happy to do it. A great discussion. There was a couple things that were raised. within the group, we had a lively discussion around this one. The big part, this is the first one, would be that the flexibility or that it wasn't prescriptive, and it gave the groups the resources and allowed them to figure out how to use those resources to reach out to the community that they knew best. Payal spoke about this eloquently with regard to the South Asian community, and not only different languages, but different cultures, and how you have been able to craft a strategy that was going to be effective, given not only their connections to where they came from, but also the community that they're living in now, and understanding how to get the message through. The second thing that innovation that we're hoping will be continued, is this interconnectivity and this awareness around the disproportionate amount of resources that are going into communities and the inequitable impact of things like COVID on communities of color, and how this particular funding has allowed those groups that are in those spaces and who have the most contact with those groups to be able to work to address those challenges, those issues that they're facing, as well as be able to connect with each other to capitalize on the momentum of things that are also happening in the community, which a lot of it is being generated by Black Lives Matters, and the response to people being murdered on the streets. So there was a sense that this is activating a whole group of people who have credibility within those communities of color, and that they can be effective in terms of helping to not only address the health issues related to COVID, but also building agency within those communities so they can advocate for themselves.
Well, those are great examples, Tomas, and thank you very much to your group for sharing those examples. Certainly, we've heard as well through our conversations with various organizations that the flexibility and embedding some of the community wisdom about who is most important to reach out to and how to reach out to them. So great discussion in your group. I'm going to ask Caitlin Pohl if you'd be willing to share from your facilitation of Group 9, Caitlin. And if you could share an example of some recommendations that your participants in your small group shared for future teams that will be conducting outreach and systems navigation. Caitlin, if you could join us off of mute and share a recommendation about what future teams can do.
Yeah, one recommendation that came up during our conversation was doing in-person outreach during festivals, particularly religious festivals. We had a really great example of an organization getting some good visibility by, they actually showed up at a temple and gave out COVID-related information, and it sounded really good, building a rapport with that community during that time. It said, we talked a lot about giving out hygiene products like packages of hand sanitizer along with the COVID information, and that seemed to be a really effective way to reach out to people and open up that conversation. So that was one really great recommendation that came up.
Oh, wow, that's really neat. Well, especially thinking through, especially when trying to remain physically distant in order to be able to share this information, but reaching out to areas where there might be more people who are available to then interact with. So thank you for sharing that example, and thank you very much to Group 9. I think that was your lucky number with your group. So thank you for that example. Oliver Chavez, are you able to join us off of mute and share an example from your group in terms of what practices were less effective in terms of outreach and navigation?
So I was actually in Tomas's group, and I was kind of taking notes. But one thing I'll mention is there was a lot of talk about momentum and how we could just continue this and not lose this momentum even post-COVID. There's a fear that, you're building all this trust within the community, and then there's a fear that all this work will get lost post-COVID. So that was a big kind of topic in our discussion.
Thank you for sharing that example. And I think through a gathering like this and future gatherings that might be facilitated by additional networks of outreach, systems navigation, education workers can help to preserve this community wisdom that's being built. So thank you for sharing that. I think, we don't want to lose what we're learning through this process. And this effort today is really just an effort to bridge into the next generations of efforts that will be led here in the counties. So we'll ask one more group to share, and Miriam from Community Health Councils, if you'd be willing to come off of mute and share some examples from your discussion with regard to what outreach and systems navigation practices led to community members' engagement.
Yeah, so at Pacoima Beautiful, they implemented Doctora Talks, where physicians would talk to community members. They utilize Zoom and Facebook Live to sort of present and answer questions like via Q&A that residents have around the vaccine, dispel any myths, quell any anxieties, and with this, it's been evident that representation has been a huge factor in bringing, doctors who are, Latinx, Spanish speaking, Afro-Latino, Black, et cetera, has been huge in sort of implementing and galvanizing that. And also gathering testimonials from community members who have been vaccinated and had a positive experience, and distributing that to the community via social media, and presenting at least 3 testimonials during those Doctora Talks. And then the United Cambodian Community has community members operating their hotline, and also making the calls to the community members, and sort of supporting that education as well.
Excellent. Well, thank you for sharing those examples, Miriam, especially the Doctora Talks. And we'll see in one of the presentations towards the end of our session today, examples of how that kind of conversation can continue. So thank you for sharing the examples from your group discussion with folks from Pacoima Beautiful and United Cambodian Community. So thank you everyone for sharing the examples. And we have a question and a follow-up for you, I think, Miriam, and your group, the phone number for residents that can benefit from Doctora Talks. So we'll follow up afterwards. Elisea, please, we'll keep your question in chat, and then we'll go ahead and find that contact information for you. So now I know that we have a brief poll just to check in with everyone again, and I'm going to stop sharing this slide for now. Thank you, everyone, for going into the small group discussions, and I appreciate your sharing information from your various initiatives and implementation. So, Aurora, I think you have another poll queued up for us.
Yes.
Alrighty, I think great. Thanks everyone for responding to the poll. Part of what we're hoping folks will look forward to in the coming months, as we know additional CHW outreach, navigation, education initiatives are launched, is to understand what may be the opportunities for sustainability. And so thank you very much for expressing interest in learning more about formal certification or professional classification of employment positions with regard to these activities. Towards the end of our presentation today, I'll share a little bit more about efforts that we're seeing on the horizon, and we hope to bring back more information to the group as future gatherings like this are scheduled. So thank you very much, Aurora, for that. And then I'm going to go back to our slide deck again and bring us back to our program. So one of the things that I know we've started talking about really are these future funding opportunities and initiatives that may be on the horizon. And many of you may have seen that there was a funding opportunity recently released and shared out by the LA County Department of Public Health and various sources. The Center for Health Equity shared out a new initiative that's being launched by the CDC Foundation. And through this initiative, there will be grants being made to community-based organizations across the country that are interested in conducting additional outreach, education, navigation efforts with regard to vaccination coverage. So really advancing efforts around vaccine equity. The announcement was made just about a week ago. This funding opportunity closes April 26th. They are still putting up the frequently asked questions. And if you have any questions and want to follow up with the CDC Foundation, then the contact is listed here. Her name is Nika Sorrells, and she's the Federal Program Manager for the CDC Foundation. The grants will span across the US. And so if you're interested in finding out more, please email RFP questions at cdcfoundation.org or visit the CDC Foundation website, and you'll be able to download the request for proposals and additional information. In addition, we do know that on the horizon, through the Medicaid waiver here in California, there is an opportunity for community health workers to have their efforts potentially be reimbursed under the Medi-Cal funding stream. And so a report recently posted by the California Healthcare Foundation, our colleagues that are a state health funder, this report was recently posted to their website, looking at the future of Medi-Cal as a potential sustainability route for community health workers. And so this report, if you click through to the California Healthcare website, when we send out the follow-up emails, you'll see there's a list of trainings that are considered as core elements, including, I think, some of the trainings that many of you highlighted that were effective supports for your implementation of outreach, systems navigation, and education. So 2 opportunities that we see, one on the near horizon and one certainly emerging as we look at the next Medi-Cal waivers here in California. And so want to just share that with folks. And we now have, I think, one more presentation that we wanted to share with you. And I'm going to invite to the microphone my colleague, Robin Kistler from the Kaiser Family Foundation. We're so pleased to have Robin here with us today. And Robin, I'm going to transition to your slides right now. So if you'd like to go ahead and come off mute and start with an introduction, then I'll queue up your slides for you in just a few seconds.
Thank you, Rose. This is fabulous. I hope everyone can hear me. I'm finally learning to unmute when it's my turn to talk, and I appreciate your cue. I'm Robin Kistler. I'm with KFF, the Kaiser Family Foundation, based in the Bay Area. And we are not Kaiser Permanente, and we are also not a foundation in the sense of grant making, but we are a health-focused institute dedicated to providing trusted information about health issues in the United States. And of course, that has meant for the last more than a year, COVID-19. And I think the main thing I wanted to share today are some tools and resources that we've been developing over the last few months that speak directly to this idea of providers, healthcare workers being key messengers and trusted messengers to provide the knowledge that can be helpful both for community organizers, healthcare workers, getting their own knowledge base, as well as for individuals to educate themselves as they're in the process of kind of maybe considering taking a COVID-19 vaccine. So this is us. I mentioned these things. We operate what's called the COVID vaccine monitor, and we go into the field every couple of weeks to get a sense of where are we as Americans and others living in the United States in the process of choosing, being ready to get a vaccine. And of course, the numbers that are already vaccinated have increased from January to March, but really importantly, we've also seen those darker blue bars of ready to get it as soon as we can move, and then this wait and see group continue to be a significant portion, while the definitely not going to get it folks sort of have remained about a pretty consistent number of people that, you know, folks who have for whatever reason decided it's not for them. So we're responding in particular to the wait and see how it goes information needs with a campaign called The Conversation. Next slide, if you would, please, Rose. And the basis of it is also in our surveys, showing that if you click one more time, please, Rose, that top line, that the most trusted messengers across all race and ethnicity groups are doctors, nurses, and other healthcare providers. And so we've created an opportunity to share, to give people a provider to talk to directly in case they don't have one in their community that they can turn to. Next slide. Under our Greater Than COVID initiative, we provide basic information about COVID-19, and in particular are focused on vaccine information. So if you would click for me one more time, under this initiative, the first installment of videos include this anchor video called The Conversation Between Us About Us. It includes W. Kamau Bell, comedian, talking with a dozen Black healthcare workers, doctors, nurses, others involved in the COVID-19 response, addressing common questions that we see come up online, we see in disinformation. You know, there's no microchips and basics of how's a vaccine work, what's mRNA, what was emergency use authorization, kind of the speed of the process, and you know, explaining the research that went behind that, and how the clinical trials worked. So I know that there was a link to this video of this kind of anchor 5-minute video that's a little too long to show all together for this conversation. But we would invite you to watch it. And I do have one video in this deck that's an example of one of the 50 FAQ video answers. They're generally about 1 minute, very easy to digest, subtitled. And this first series is designed and developed by and with Black healthcare workers. The information is relevant to all kinds of folks. And we are also currently in the process of creating a Spanish bilingual version. We just filmed over the last 3 days, 10 healthcare workers who speak both English and Spanish, doctors, nurses, including 4 in Los Angeles. So there will be some local familiar faces in the next wave of this messaging that should be ready in 2 to 3 weeks. So look forward to sharing that out with this group. If you would mind clicking to the next slide. This is the video just to give you a taste of what we have. And in listening to our small group, I'm thinking about how can we use this content to educate those who are going door to door and out in the field doing the work of educating one-on-one, both to make sure that they have their questions answered, and also as a resource they could share from a phone or an iPad that they may be carrying around and able to share directly in the community. So let's just take 1 minute to watch this example. I chose that if I'm young and healthy, why do I need? Because the group that is now the most likely to say they're not going to get a vaccine are the under 30s who don't feel like COVID is a big risk for them. So why would they need a vaccine? So this video answers that question.
Great. And if folks would like to temporarily for a minute or two just drop off camera to help with the transmission rate. I know that we've been having tech difficulties on our side. So I'm going to go ahead and start the video now. And thank you everyone for helping out with our bandwidth issues. And let's see.
I think if you click one more time, it should play for you. Just to open the next slide.
Yeah. There we go. Oops, I think it went ahead too. Yeah, let me.
I heard it
try
for a
that
second.
again. Sorry, folks.
So a couple reasons. So one, doesn't mean you won't get sick. So younger people can get sick. Younger people can have what we call morbidity or lasting illness. They may not die from it, but they may have ongoing lung problems or neurologic problems or other things like that. But I think the other thing that we think about in pediatric is what is your risk in your community? So, you know, I just told you we have a bunch of children who cannot get the vaccine, but if you are, let's say, 18-year-old who gets COVID infection and you give it to a 5-year-old and then they go visit grandma who's 80 years old, now you've infected someone who may die from it.
So it just gives a taste of the type of, you know, quickly digestible answers to a common question. There are more than 50 of them. And they're questions that cross race ethnicity groups too. So I'm presenting our series that was created by, with, and for Black communities in mind in particular. We recognize there are many communities that have specific information needs and need culturally responsive messengers, credible information for their communities too. This was a starting place based on the mortality rates really that we were seeing, and was built in an initiative together with the Black Coalition Against COVID and a group of physicians in particular who were responding to disinformation online. And so we came together to be able to produce those pieces. And we are thrilled, including with some support from CCF, to be able to create a Latinx Hispanic version as well. I know there are many other information needs, but hope that we can find some ways to use this for the communities for whom it's appropriate in Los Angeles County and to integrate with what you all are doing. So I think that maybe, I think there might be a couple of examples of how some community groups are using. Rose, if we just take a few more seconds to show some.
Absolutely. Thank you very much, Robin. I think there's some questions in the chat in terms of future production with regard to Asian and Pacific Islander communities.
We do not currently have resources to create those. We have certainly heard the need. We're a national program, so we're looking across section at what resources we have and what we can produce and need to prioritize based on those. So we don't currently have funding, and it feels like the window is very short. I think we may be doing this for some months ahead, but we are a team of 8 people. So we started with what we had and what we could do and contribute. And I know that there are other resources groups are producing, in particular, the Ad Council has a number of things rolling out, and a number of the immunization coalitions have been creating, particularly I'm seeing in the comments, some of the AAPI communities, resources in language and with local providers. So one thing that we're seeing people do as a result of this campaign is to use it to inspire their own campaign. So I was talking, for example, with South Dakota. They have a big Nepali community there. So working with a local provider there to create something similar and using the same questions, but a local messenger, or town halls. I think it was Miriam was talking about earlier, sort of having the live Facebook event and the opportunity to have a conversation. So we think of the conversation, obviously the information is available here. It will resonate for some groups more than for others, but it can also inspire and be a model for others. So some of the pieces you've seen flash by are getting it out in social media, having town hall events. We met with about 30 Black pastors last week who are committed to COVID-19 testing and getting vaccine information out in the communities in Los Angeles and other Southern California counties. So are very eager to connect with community sort of on the ground networks, in addition to what we're doing with California Department of Public Health and YouTube and Facebook to get the messaging out digitally. I think the ground game, and certainly from listening in on the small group today, hearing the opportunities of one-on-one conversations is really helpful.
Thank you very much, Robin. You mentioned a few resources in terms of other communications campaigns that are also reaching out specifically to Asian American and Pacific Islander communities. If you would be so kind as to share some of those names and organizations with us, we'll make sure to post it to the after meeting materials so that folks can click through to those other examples that you shared. And I know we do have about a minute to take a question from one more question from our participants with regard to the conversation and the presentation that Robin Kistler just made from Kaiser Family Foundation. So thank you very much, Robin. Is there a question in the chat? We could probably take one question right now in terms of Robin's presentation.
Rose, I do see one about looking for more information on the graphs of the wait and see portion. So all of that data that I was sharing of the surveys that are fielded every few weeks is available at kff.org, as in Kaiser Family Foundation, kff.org, in the Vaccine Monitor. And they analyze it every possible way you can imagine. So you are able to see those splits and how they've changed over time, different groups, political affiliations, age groups, and other demographics. And
Okay,
I'll be
great.
very glad to send some follow-up links for some of the groups that I've heard are doing. I was just on a call with some Cambodian and Vietnamese messaging that's coming out of Pennsylvania that may be of interest, and others.
Great. Well, thank you very much for sharing those resources. I know that we had just a little bit of time to share the conversation between us about us today. Folks, if you RSVP'd for the meeting today, the link was also sent out to the video library that's been created. And as the next version for Spanish-speaking communities is released, we'll be sure to reach out to folks on the call. I do have one more, I think, announcement, and Ray Chung, if you're on the call and would be willing to come off of mute, I will try valiantly to get your link up so that we can go ahead and share the NHP, Native Hawaiian Pacific Islander Asian American high COVID risk areas image that you shared with me. And
Sure.
Ray, if you could just briefly introduce yourself and your organization, just so people know who you are and they can network with you. And if
Yeah.
you'd like to drop your contact info in chat, then folks will be able to reach out to you directly as well.
Great. Well, thank you, Rose. And I won't take too much of your time, but my name is Ray Chung with Smart LA, and we're partnering with actually Asia Pacific Policy Planning Council to really start thinking about the NHPI and AA communities that are really vulnerable to COVID. And what we've done is created a COVID index specifically for the NHPI and AA to support all the community organizations here that are doing really important community frontline interventions, so we can really start thinking about how we can protect these communities. And what you see on this chart is we have a map that's interactive that pinpoints in LA County, the NHPI and AA communities that are susceptible to COVID outbreaks. And we have an index, it's interactive for all the areas. And we also measured, as you can see, a low vaccination areas. Another aspect of this is that we're actually monitoring and detecting COVID symptom hotspots through actually social media, that where we believe that these might be leading to actually COVID cases. And it's based on a Harvard study that pinpointed using social media data signals that predict COVID outbreaks up to 14 days. So you can see on this chart where specific areas that up to the week of April 14th, that we see potential COVID outbreaks. And hopefully this kind of information with all the great work everyone's doing on the front lines is to get that, those interventions, those outreach, those vaccination resources to those communities, particularly for NHPI. So I'll just take a pause there, and I'll leave you my email. We will be updating these reports once a week. AppCon and Myron and the team is available to, they have the resources, and we also are thinking of better ways to improve this, to make it accessible and actionable for the community health workers that are definitely in the front lines, and hopefully this is some of the information that can support our communities. So thank you, Rose, for the opportunity.
That was fantastic, Ray. And as you can see, we are a fan of maps here at the team, just based on what you see in our background. So thank you very much to everyone who shared of their time, their community wisdom, and fabulous maps. Lorenzo, I see you and your maps. That's a pretty awesome background that you have there. Would like to ask, I think, as part of our final seconds together, and I know we've gone over by about a minute, is if folks would like to continue to network with one another, if you could let us know if you do not wish to have your contact information shared, we would like to make the participant list available to everyone who RSVP'd. So if you RSVP'd and you would not like us to share your contact information, please message one of the hosts and we'll make sure to move your name off of the contact list. But we know part of the value of these convenings is that in an in-person world, we'd be jumping between tables and trading cards and reaching out and saying, how do I contact you? We don't have that ability now, so we'd like to offer it as another way for people to connect. So thank you for your time, and following the convening today, we will be sending out the recorded portion, and we'll be summarizing the proceedings for you. So that might take a little bit of time, but we'll be sending out the slides and other resources that were shared on the convening today. So thank you very much to Community Health Councils, Department of Public Health, Center for Strategic Partnerships, Department of Health Services, Department of Mental Health, my colleague who's leading the COVID Community Health Project with CDSSF, and also all of you. Each one of you are a point of light here in LA County as we continue to move towards the end of this very long, dark tunnel. And so you have my appreciation, mahalo nui loa, and please enjoy the rest of your day, everyone. See you later.